Many children with autism rely on Medicaid to get the critical therapy they need. But next year, New York State wants to cut spending by millions. Tonight, some healthcare centers tell investigator Mahsa Saeidi if those cuts go through, they may have to close, leaving the kids behind.
He made so many good behavioral changes. He doesn't hit, he doesn't bite.
Shannon Finstead fears her son is about to lose the therapy that's changed his life. For 3 years, Sebastian's received treatment at Applied ABC, an autism center in the Bronx. Now, leadership at the center says New York's proposed cuts to Medicaid will reduce rates, forcing their staff to leave. To make a living, therapists like Dorothy Kim would have to work with families with private insurance, not Medicaid.
So it creates, I think, a greater void, less resources for a population that already is kind of picking bones at this point.
In her budget, the governor is proposing to cut $30 million over the next 2 years. At a hearing in Albany last month, lawmakers questioned the state health commissioner about the impact of the cuts.
How many kids who have autism who are currently in the juvenile justice system or in foster care are going to lose access to this benefit?
It's still a fair wage. This is what most other states have done. I mean, I think we were different.
Forgive me, Commissioner, the fact that most other states have done it doesn't make me feel better.
In a statement just released, the governor's office says she's, quote, fought to invest more than $30 billion to support this community. And this proposal will not impact a single licensed provider in New York.
Okay, so Mahsa, there's a major discrepancy here. The state is saying this is not going to impact licensed providers. What do you make of this? What was the explanation?
It is very confusing, isn't it? So advocates tell me there are two types of providers. Licensed analysts, they're the ones that design the treatment plan. Then there's a certified analyst. These are the folks that do the actual treatment. Late today, the state called those folks unlicensed and even unqualified. But advocates tell me these are the folks that are doing the majority of the work. So if they're unlicensed and unqualified, why are they doing the majority of the work? We'll dig into it tonight at 11.
It seems like they're an integral part of the system also, right?
They're like the whole system.
Yeah. All right. Looking forward to that story. Thank you, Mahsa. And if you have a story for Mahsa that you would like her to investigate, just scan the QR code on your screen. You could end up seeing that story on our air.